Hello students, I'm presenting information on basic terminology for ethics. And again, reminding you that in this course, we are helping you to transition as you go forward. Right now, your career plans may be a bit open-ended because it will depend on what options are available to you, what geographic location you find yourself in, and the job market. I may have shared already with some of you, but my very first job in the profession was in the school system. And that may surprise you because I was always focused, even in undergrad, on going into the medical side of speech language pathology. However, that was not the opportunity that presented itself to me when I finished grad school, and I needed a job and I needed to make some money. So I knew that once I got my C's, I would have more opportunities open to me, and that was my mentor encouraged me to go ahead and get started working, and I was successful in completing the CF and then jumping back into the medical side of speech pathology. So you never know how things may turn out, but in this course we will talk about the different things that you'll face as a professional. So as a reminder, there are three main areas, so everything that we touch upon should be focused on one of these three areas. For ethics, we're going to go over some specific definitions and what that means to you and how that applies to you. We've already begun to look at some scenarios in class, and some of you have also shared some of the things that have come up in your settings. Credentialing is the step-by-step process for licensure and certification, which we will go over as well. And then for professional issues, these are the topics that you're presenting in class, the questions and the thinking that is being presented in your group discussions, your class-led discussions. These will help you to address some of the issues that you will face in your professional practice. So we're going to define some terms and also talk about some common areas of conflicts and dilemmas. Now, I don't know how many of you live in Baltimore or have been in Baltimore City, but this probably does not look familiar to you because this was about 50 years ago. And believe it or not, looking right now, this is the same spot in Baltimore. This is the Inner Harbor area. So looking between these two pictures just helps us to see how things can change quite a bit. So our profession of speech language pathology has changed so much in terms of our scope of practice and not only what we can do or do as professionals, but the whole world around us has been changing. The demographics are changing, the technology that's available us to has changed as well, insurance practices, etc. So sometimes the change can seem drastic. So as we talk about ethics, this really provides the foundation of our practice, and it provides guidance as to how we can be the best professionals. And it also, because it is something that it needs to be a part of us as a professional, we will also see that conflicts may arise that creates dilemmas for us. And so our goal is to always make sure that we are applying ethical practice and looking to solve those dilemmas in the best way. So we want to take a look at how we can define ethics. And when we think about ethics, there are many terms that are also related. So you take a look at this list and just think about where these terms come from and also what definitions are. And that's what we're going to talk about next. But remember, in that first discussion that we had, the questions that are on the right-hand side, I asked you to consider those as you looked at a list of different situations. And one thing that I noticed is that within your groups, there was some disagreement at times with one another, and also some uncertainty about how you should label a thing, whether it was right or wrong, or legal or illegal, moral versus immoral. Well, actually, legal was usually the easiest thing to figure out, but that really points at a very common issue. So here's one of the situations that we had. It was about being a babysitter and how that the father was going to refer his clients to you, learning that you were going to be practicing now. And so there was some disagreement as to whether this was right or wrong. Some people were very adamant about it, and other people were sort of, yeah, I'm not sure. I think this might be, a thing that's okay. The reason why there was disagreement is because you were looking at it from different lenses. So depending on the lens that you're looking at, are you looking at it from a legal perspective? Are you looking at it from a personal value system? So for example, I'm sure that many of you in your own community, in your own family, will refer or recommend people who you feel are good, or you may even go to people who you know and say, who do you think is good for this? And then some of you were thinking along the lens of professional standards, and that may be why you felt that there was some reason for concern in this situation. So this talks about what ethics is based on the whole study of, or the field of study related to ethics. And you might be surprised that ethics is not feelings, etc., as described on this slide. This slide gives a definition or a description of ethics. And again, this center that's listed there is a wealth of information if you ever want to look at ethics and many standards and where that all comes from. But it really tells us how we ought to act, and you see the word standard there. So there is some standard that is developed. This slide gives a definition of ethics. So we can see that we can look at something as a set of moral principles or standards, and then we can also use the term ethics to refer to the whole discipline that's related to ethics. You know that you can have whole courses on ethics. And this slide, values, goes back to looking at the different terms that we had and saying, well, where does this come from? So values was an example of a term, or where we get our values from is really related to quite often our family members or a community group that we might belong to. Morals is another term, and oftentimes our values and morals are linked together. And again, this often comes from our family, it may come from our religious beliefs or community. Law is another term, and it's very specific to some authoritative agency or body that can enforce the law. So that is different as well. And we may see conflicts that arise. We may feel that something is immoral, but it may also be lawful. Something to keep in mind, a reminder on this slide, what we ought to do versus what we must do. And again, this goes to the fact that laws can be enforced, and that there can be some penalty if you don't follow the laws. Now, when we talk about code of ethics, this is formal. So now we're talking about something that has been established by an organization. I apologize, I'm shifting this frame so you know that it's ASHA at the bottom, but gets cut off a little bit. So we have, a specific set of rules. Now, it's important to also note that these are guidelines and not law. So when we have code of ethics from ASHA, these are guidelines, things that we should follow, and that we actually agree to follow. When I renew my membership with ASHA, I'm also making a commitment and agreeing to a statement that says I will abide by the code of ethics for ASHA. But ASHA is not an a legal or law enforcement body, so I can't break their laws, but I could, breach the code of ethics. And that's different if we're talking about a state licensure board, for example. Oftentimes, students will pause when they see this. I can say that I think it was Emmy in Thursday class who gave a really good example, and I can't remember exactly what she said, but the thing that you see, this almost looks like a paradox, but remember that when we are ethical, we really want to go above and beyond. So when it says that we might do more than what is required, let's say that you're seeing a patient and you go in, you do some dysphagia evaluation, you make some recommendations, you write everything up, and then you go on your merry way. Well, you may go above and beyond. You may actually track down the nursing tech who's working with that patient, because you know that that person is really going to be the person who will make a difference. Within the next hour, she's going to come in and follow those recommendations. And if nobody tells her, then she might go on and do the same things that she was doing, or you might make some phone calls or reach out to the family. And you don't always have the time to do that, but sometimes if you feel that this is something that will make a difference in that person's care, you may reach out and do a bit more than you're required to do. And then the less than you're allowed to do, again, there are many different situations, but let's say you have a client and maybe it's your private practice, maybe you get a child, maybe you're allowed to see them for 10 sessions, and maybe you find out, well, they really only need 3. Well, legally you could do the 10 sessions, you could probably stretch out what you're doing, but if ethically you really believe that it's not necessary, or even maybe they don't need the therapy, even though you may have been pre-authorized, then ethically you would, make sure that you only do what is necessary. Okay, so there are other important terms when we think about ethical principles, and these are terms that you may or may not have heard before, but they're really important when it comes to ethical practice. So autonomy is one that comes up quite a bit, and particularly when we think about things like dysphagia, and whether or not that person is safe to eat, and the decisions that they might make as to whether or not they want to continue eating. So we never want to take away that person's autonomy to make their own decisions if they're capable of doing that, and that the person has the right. And I think, as I mentioned before, that does come up a lot. Dysphagia is one of those situations. We're dealing with an adult who wants to make choices. So we want to make sure that we give them all the information that they need to make an informed choice and a safe choice, but we don't want to take away their capacity to make their own decisions. And beneficence is making sure you're doing what is good for someone, and non-maleficence means that you're going to avoid harm or evil. And again, those two things might sound similar, but the beneficence is doing everything in their best interest, and the third one is just, again, they are closely related, but not doing anything that is harmful to them. And justice is making sure that there is a fairness that's there. So even if you have a client who is difficult to deal with, you wouldn't be less ethical with that person, or not as willing to provide services to that person just because they are difficult, or maybe that person has a shady background or something that doesn't align up with your value system or morals, but you wouldn't treat that person any differently. Other ethical terminology, informed consent is one that you're very familiar with, because right from the start in our clinic, we talk about informed consent, and we have the clients sign, or the parents or the adult individual sign for informed consent. Veracity and fidelity are closely linked. So in terms of being truthful with information and keeping promises, sticking to your word. Confidentiality, well, with all of the HIPAA practices that we do. Duty, rights, and paternalism are other ethical terminology that you should be aware of. And one thing that happens when it comes to duty is that once you become a speech language pathologist, there are certain things that you've now put on that clinical hat. So there are certain things that you are expected to do You're expected to provide services in a certain way. And you could actually, these are the type of things if a person wanted to say, that you didn't really provide the best practice and it was your duty to do that as a speech language pathologist. So once you put on that professional hat, you are then held to a higher standard based on the role that you are in. Rights goes to the rights are for the clients, the patients, the student who you might be treating, but you also have rights too. So if someone is really difficult, if a patient or client is verbally abusive or physically abusive, or the same thing with a family member, you do have the right to not undergo something that is harmful to you as well. Paternalism is a negative thing, and this is really something that we often see. Sometimes it is meant for the good of the person because someone who's in a medical authoritative position or a healthcare position feels that they know the best decision for that patient or client. But remember that we don't want to take that person's autonomy, and we want to make sure that we're not, being paternalistic in a negative way. Or, well, it is negative to be paternalistic, taking away that person's choices. So conflict of interest is another term that we should be familiar with in ethics. And this is one of those things where you may have your own private interests, and then you also you're in this official role. So again, once you're in this official role, there are different standards that you have to abide by. And I think that was also one of the things that came up when we looked at some of the scenarios, like not making sure that you don't put yourself in a situation where there is a conflict of interest. Another thing to keep in mind when we think about conflict of interest is that sometimes you or the person who's involved in that potential conflict may not be the best judgment of that. And because we have a personal interest. Someone in class gave an example of someone, a speech pathologist on staff, and that person's family member was admitted in on the unit, and how the manager or right away said that that speech language pathologist could not interact or be involved in the case in any way for that family member because of the potential for conflict of interest. So we know that it would be hard for that SLP to treat that person in a neutral manner as he or she would anyone else. So to avoid that, then that's one of those situations where you would just not have that person assigned to that patient or client. Professionalism is one of those things that we sort of know it when we see it. Is this person being professional or unprofessional? But that's also something that we want to think about when we think about ethical practice. So I have just a few quotes here that I think are important. And then just quickly, when we think about ethics, again, just understanding that it goes way beyond just one word, but it's a whole field of practice. There are different standards or different approaches that are used to define or delineate what ethics is. So, for example, we know that, as I mentioned, that ASHA has drawn up a code of ethics which we follow, and how do we determine what should be on that? Because truly, as members of ASHA, we all have the ability to participate in that process of creating code of ethics. When it was revised just in, I think, 2016, that information went out to all of the members to provide input onto what should be in the code of ethics. And then these sources of ethical standards just list how we come up with codes of ethics or ethical standards, for example. So you can see those listed there. So, balancing the greatest good, looking for the greater good, looking at moral rights. Number 2, number 3, looking at fairness. And then there's a site listed here, the Center for Applied Ethics, which I mentioned, has lots of information if this is a topic that you want to study further. And then there are a couple more standards. Another, the common good, so basically looking at, for the whole, what's good for everyone and protecting everyone, especially for those who might be vulnerable individuals. And then the 5th, considering that the highest virtue. So these are all things that help to draw up or help to establish what we define as ethical standards. So for unethical, okay, if it doesn't conform, if it's against what we've decided are standards, that one's easy. But it can also vary. Sometimes there can be gray areas because sometimes things are not quite black and white. And we saw that with some of the scenarios. Purposely gave you a few that were sometimes a bit tricky to determine right away. So this quote just reminds us that the downside of unethical practice is that it really can affect not only the patient, but all of us. So think about something like Medicare fraud, for example, and the ripple effect and the repercussions of that. Think about something like in the school system, when you have a child with an IEP is not being followed. So it can definitely have a ripple effect, not just for the individual, but across the profession, might be seen in a more negative light. The resources that may be used if there's some type of reimbursement issue, and then creating difficulties in policies or changes that may be needed in policies. When we think about ethical conflicts, we want to think about what could be done, like what you could get away with versus what you should or should not do. And again, just a reminder that it goes across personal, organizational, and societal situations. This again reminds us that it is our objective and also our duty to know what the standards of conduct are, what the standards and the codes are within our profession, because we are held responsible for that. These are other quotes that are also important. And again, this is just reminding us that ethical practice needs to be in the forefront of what we do, not just the icing on the cake. And again, that it's our responsibility to know what the standards are. So we've already brought up some ethical dilemmas and conflicts, and some of you have already shared them. And this is just a reminder that at ASHA, they have a board of ethics, and they have over 3,000 inquiries a year related to ethics. So that's quite a bit. Here are some of the common themes that you see. You can take a look at that. Now I have asterisks on employer demands and supervision and use of support personnel because I asked the Maryland State Board of Examiners executive director if any of these, what did he see as common themes for inquiries or cases that had come up with ethics in the state of Maryland. So those tended to be more. On the previous slide, I had asked if people felt like, I'm sorry, I'm just go back for a second. What do you think are factors or situations that create dilemmas, and what has caused an increase? So the fact that we have an increase, one reason is related to the fact that our scope of practice has changed, right? So if we think back of the old picture, the new picture, so for example, autism was something that now we have many more cases of autism, and so there is a responsibility that we can practice, within that field and appropriately assess and treat individuals who may be on the spectrum, and that's something that wasn't there before. If we think of something like dysphagia, for example, that wasn't there, that there weren't even courses on dysphagia 35 years ago, that there weren't even courses on dysphagia, and now we have dysphagia, but we even have, FEES, modified barium swallow studies, the fact that we have invasive, practice invasive instrumentation like FEES that wasn't there before. So scope of practice, things that we see in the community, some of the reimbursement issues and how that's changing all the time. So these are a lot of different reasons why we see and have seen an increase in some of these issues that have come up in terms of ethics and ethical practice. And I'm sure as you go down this list, there are many things that might come to mind as to why we see these dilemmas. Employer demands, you're going to have students who are talking about productivity in the workplace, and also the workload versus caseload. So sometimes people's caseloads are so tremendous in the school setting and productivity demands in the healthcare setting. And the fact that for support personnel, one example is the fact that we do have speech-language pathology assistants, and we didn't have those years ago. Okay, so to keep in mind that as we look at addressing professional or ethical dilemmas, we really need to have a toolkit for addressing them. And the toolkit involves these things. So we need to have a professional code of ethics, that's through ASHA. We need to know what our scope of practice is. We need to know what the preferred practice guidelines are. We need to know what the laws and regulations are, state and federal. Now, there will be a professional code of ethics, there will be a code of ethics at the state level, and I'll take a look at that for Maryland. And then Ethics 101 is really this slideshow where you kind of look back and say, what are some of those terms? What does that mean? We talk about autonomy, for example. What does that mean? So what is the law versus a code of ethics by a professional organization. We need to have some examples and samples because we can use that to sort of base some of our guidance, to provide guidance and decision making on. So some of the scenarios that I've presented and will continue to present are helpful in that way. And we need to have a proactive intentional plan, which we'll lay out as well. And in addition to this, we also need to make sure that we are using mentors, other professionals that were not intended to be able to address everything independently. Things like wisdom and experience are important, particularly in those areas where we said there's some times when things are not always black and white. We definitely need to know what those established standards are, but we also need to be able to use some other professional judgment and wisdom to help make some decisions as well. So we're going to stop this this slideshow and then start another one. The other one will be specifically addressing the ASHA Code of Ethics that was revised in 2016.